family, welcome back. You're listening to the FluentEars English Podcast, where English learning feels like real conversation, not like a boring classroom lecture.
That's right. And today, you're tuning into episode 14B. This one's really special because it's the second part of our medical vocabulary series.
Yes, if you joined us for episode 14A, you'll remember we laid down the foundations. We explored medical terminology, body systems, symptoms, and conditions. We basically built the vocabulary toolkit you need to survive inside a hospital.
Exactly. And if you haven't listened to episode 14A yet, here's our recommendation. Press pause, go listen to it, and then come back. Because 14A is like part 1 of the story, and today's episode, 14B, is part 2. Together, they give you the full picture.
Now, why are we doing this series? Well, so many of our listeners told us they get nervous in hospitals or clinics where English is used. They don't know what to say, or they worry they won't understand the doctor. That's exactly why we created this medical vocabulary and conversation series.
And we've placed it inside 2 of our most useful playlists, the Real Life Conversation playlist and the Medical Vocabulary and Conversation playlist. So no matter whether you're practicing English for daily life or for a professional setting, you'll find this episode right where you need it.
In 14A, we focused on words, prefixes, suffixes, body system terms, and common symptoms. But in 14B, we're taking the next big step. Today's focus is conversations.
Yes, full doctor-patient conversations that you'll actually hear in real life. Plus, we'll walk through the hospital environment, how to talk at reception, with nurses, in waiting areas, at the pharmacy, or when you're being admitted and discharged.
So think of this episode as practice for real hospital English. By the end, you won't just know the words, you'll know how to use them naturally in conversation.
And as always, relaxed. We'll keep things practical. You'll hear everyday English, the kind patients use, side by side with professional English, the kind doctors and nurses use. We'll also explain idioms and phrases so you sound fluent and natural, not robotic.
We'll even pause for practice sections, where you can try to respond out loud. Because remember, listening is good, but speaking is where fluency grows.
So here's the roadmap for today's episode. First, we'll dive into doctor-patient conversations. These will include checkups, specialist visits, test results, and even how to express worries or emotions. Next, we'll step into the hospital and clinical environment. We'll explore the language of navigating reception, wards, nurses, admission, discharge, and even politeness in hospital culture.
That's a lot to cover, but don't worry. We'll guide you step by step, and you'll leave this episode with phrases you can use immediately.
And just in case you're wondering, no, you don't need to memorize every word. The key is exposure, practice, and confidence. Every time you listen, you'll get more comfortable.
So grab your notebook if you like taking notes, or just sit back and listen. This is English learning the way it should be. Practical, fun, and connected to real life.
All right, let's jump into our first section, doctor-patient conversations.
Okay, FluentEars family, let's start with the most common hospital situation, a general checkup.
Yes, when you go to the doctor, usually the first thing they ask is, "What brings you in today?"
Good morning. What brings you in today?
"Good morning, doctor. I've been feeling very tired lately, and I thought I should get a checkup."
All right. How long have you been feeling this way?
"For about 2 weeks."
Notice the key question. What brings you in today? This is a very natural way doctors begin. It's polite, short, and open-ended. The patient doesn't need complex English. Just describe the main problem.
Yes, and another very common question is, "How long have you had this?" Doctors always want to know the duration of your problem.
Let's add more useful phrases for checkups. Routine checkup, a regular visit even if you're not sick. Medical history, information about past illnesses, surgeries, allergies. Follow-up appointment, a second visit after the first one.
"Doctor, Have you had any surgeries in the past? Patient. Yes, I had my appendix removed when I was 18.
See how simple that is? You don't need long sentences. Just answer clearly, yes or no, and give a short detail. Okay, FluentEars family, let's practice. I'll read a doctor's question and you try to answer out loud. Doctor, what brings you in today? Possible answer. I've had a headache for 3 days. Doctor, how long have you had this? Possible answer. For about a week. Doctor, do you have any allergies? Possible answer. Yes, I'm allergic to peanuts.
Great work. The point is, keep your answers clear, short, and direct. That's the style doctors like.
Now, sometimes after a general checkup, the doctor may say, I'm going to refer you to a specialist.
A specialist is a doctor who focuses on one area of medicine. Let's learn some common specialties. Cardiologist, heart doctor, dermatologist, skin doctor, pediatrician, children's doctor, neurologist, brain and nerves doctor.
Here's a sample dialogue.
I think you should see a cardiologist.
A cardiologist? What does that mean?
A cardiologist is a doctor who specializes in the heart. I'll give you a referral letter.
Okay, thank you. Here, the patient used a very common phrase. What does that mean? Don't be afraid to ask doctors to explain. It's natural and expected.
Another important word is referral. A referral is when one doctor sends you to another.
And you might also hear second opinion. This means asking another doctor to check the same problem, just to be sure.
Let's also learn 2 idioms that might appear in these conversations. A second opinion. Not just medical, but in general English. It means checking with another expert. Example, I didn't buy the house until I got a second opinion from another real estate agent. In the same boat. To be in a similar situation as someone else. Example, many patients are nervous when they see a specialist. You're not alone. You're in the same boat.
These idioms make your English sound more natural and less stiff. Okay, let's try one together. I'll say a symptom, and you guess which specialist you should see. You have chest pain, cardiologist. You have a skin rash, dermatologist. Your child has a fever, pediatrician. You have headaches and seizures, neurologist.
Perfect. The more you practice, the faster you'll remember.
So far, we've covered checkups and specialist visits. You've learned how to answer doctors' questions clearly and how to understand referrals.
But what happens after tests and scans? Doctors often need to explain results. That's our next stop, explaining test results in English.
All right, FluentEars family. You've had your checkup, maybe some tests, a blood test, an X-ray, or a scan. Now comes the important part. The doctor explains your results.
This part can feel scary, especially if the doctor uses difficult words. But don't worry, we'll show you how to understand the main phrases and even how to ask for simpler explanations.
I have your blood test results here. Your blood sugar level is higher than normal.
What does that mean, doctor?
It could mean prediabetes. That means your sugar levels are not in the safe range, but not yet diabetes. With diet and exercise, you can bring it back to normal. Notice how the patient used a simple question. What does that mean? You don't need to memorize complex phrases. This short sentence is powerful and natural.
Yes, and doctors often simplify results when you ask them. For example, instead of saying hyperglycemia, they might say high blood sugar. Useful phrases for test results. Your X-ray shows a small fracture. The scan indicates some inflammation. The test came back positive/negative. We need to do a follow-up test. The results are within the normal range.
These phrases are very common. If you understand just these, you can catch most of what doctors say about test results. Let's practice. I'll read a doctor's sentence. and you try to say what it means in simple English. 1. Your cholesterol is above normal. Answer: you have high cholesterol. 2. The X-ray indicates no fracture. Answer: your bone is not broken. 3. The scan shows mild inflammation in your stomach lining. Answer: your stomach is a little irritated.
Perfect. This shows how doctors often use technical words, but you can break them down into everyday English.
Let's learn a couple of idioms connected to health reports. Clean bill of health means everything is normal. Example: after the checkup, the doctor gave me a clean bill of health. No news is good news. If the hospital doesn't call, usually the results are fine. Example: the doctor said if they don't call me, it means no problem. No news is good news.
These idioms are not medical terms, but you'll often hear them when people talk about results.
Now let's imagine you're sitting in front of the doctor and you're worried. How do you express your feelings in English?
This is very important, because health is not just about the body. It's also about emotions. Patients often feel anxious, nervous, or afraid. Doctor, I'm worried about these headaches. Could it be something serious?
I understand your concern. From the tests, it looks like migraines, which are not life-threatening but can be painful. We'll create a treatment plan. Notice how the patient used "I'm worried about" and "could it be serious?" Very natural, polite, and clear.
And notice how the doctor responded. I understand your concern. This is reassuring language. Doctors often use phrases like, "It's manageable," "We'll take it step by step," "There are treatments available." Vocabulary for emotions in hospitals: worried, general fear or concern; anxious, nervous, uneasy; relieved, happy when stress is gone; overwhelmed, too much to handle; hopeful, expecting good outcome.
These words are not technical, but they are powerful in communication.
Let's try a quick exercise. I'll describe a situation, and you try to say how you feel in one word. 1. The doctor says your test results are normal. Relieved. 2. You're waiting for surgery tomorrow. Anxious. 3. The doctor says your condition is treatable. Hopeful. 4. You just received too many instructions at once. Overwhelmed.
Excellent. Now you can describe not only physical symptoms, but also emotional states. Here are a few idioms people use when talking about health and emotions. A weight off my shoulders. To feel relieved. Example: when the doctor said it wasn't cancer, it was a huge weight off my shoulders. A wake-up call. A serious warning that makes you change. Example: his heart attack was a wake-up call to start exercising. Facing your fears. Dealing directly with what scares you. Example: going to the hospital was tough, but it was about facing her fears.
These idioms connect health conversations with everyday English. They're great for sounding fluent.
So, now we've covered a lot. General checkups, specialist visits, test results, and even how to share your emotions with a doctor.
Yes, and remember, hospitals are not only about conversations with doctors. You'll also talk with nurses, receptionists, and hospital staff. That's where the environment matters.
Which is perfect because our next chapter, Chapter 5, is all about the hospital and clinical environment. All right, FluentEars family, let's imagine you've entered a hospital for the first time. You'll see signs, doors, and departments everywhere. Knowing the right words helps you find your way.
Yes, here's some essential hospital vocabulary. Reception, the front desk where you check in. Waiting area, where patients sit before seeing the doctor. Ward, a room with several patients' beds. ICU, intensive care unit, for very sick patients needing close care. Pharmacy, where you collect medicine. Discharge, when the hospital officially lets you go home.
Excuse me, where is the pharmacy?
It's on the ground floor, next to the emergency room.
Thank you.
Notice the polite way the patient began. Excuse me, where is? That's the best formula for asking directions anywhere, not just in hospitals.
I'll say a situation, and you choose the correct hospital location. 1. You need to pick up medicine. Pharmacy. 2. Your grandmother is staying with 3 other patients. Ward. 3. You have to check in for your appointment. Reception. 4. A family member is in very serious condition. ICU.
Great work. The more you practice, the more confident you'll feel walking through a hospital.
Doctors are important, but you'll often speak more with nurses and hospital staff. They guide you through tests, treatments, and daily care.
Here are some very common nurse phrases. Please take a seat. Roll up your sleeve, I'll check your blood pressure. We'll monitor you overnight. Please sign this consent form.
Good morning. I need to check your temperature.
Sure.
Please put this thermometer under your tongue.
Notice how polite and clear the nurse is. Short instructions, friendly tone. Patients usually respond with short, cooperative phrases. Sure. Okay. No problem.
Here's a useful idiom. You're in good hands. It means you're safe with professionals. Example, don't worry, you're in good hands with our medical team.
Another one. Round the clock. All the things. Example, the nurses give round-the-clock care in the ICU.
I'll say a nurse instruction, and you try to answer politely. Nurse, please wait in the hallway. Answer, okay, thank you. Nurse, could you sign this form? Answer, sure, no problem. Nurse, I'll check your pulse now. Answer, all right.
See? You don't need complicated sentences. Just be polite and cooperative.
Now let's talk about 2 important hospital moments: admission and discharge.
Admission is when you enter the hospital to stay. Discharge is when you leave.
Admission form, paperwork for entering hospital. Insurance, financial coverage for treatment. Discharge summary, doctor's written report when you leave. Prescription, paper with medicine instructions.
Please fill out this admission form.
Okay. Do I need to show my ID?
Yes, and if you have insurance, please include those details.
You're ready for discharge today.
That's good news. What do I need to do?
Here's your prescription and discharge summary. Please take these medicines as directed. Notice the patient's question. What do I need to do? Simple and perfect when you're unsure.
In many countries, asking about costs is common. Here are polite ways to ask. Could you tell me the total cost? Is this covered by insurance? Are there any additional charges?
Politeness matters. Doctors and staff are more helpful if you ask with could or please. Now let's step back. Hospital English isn't only about vocabulary, it's also about tone and politeness.
Here's the rule of thumb. Be clear, be polite, be calm. Polite phrases for hospital situations. Excuse me, nurse, could you help me? May I ask a question about my medicine? Could you please repeat that more slowly? Thank you for your help. Give me water. Excuse me, could I have some water, please?
Of course, I'll bring it right away. See the difference? The meaning is the same, but politeness creates respect and cooperation.
Let's finish this section with some idioms about hospitals. To be in recovery. Healing after illness. Example, he's still in recovery after surgery. To be back on your feet. Healthy again. Example, she was back on her feet after 2 weeks. Take it easy. Relax, don't do heavy work. Example, after discharge, the doctor told me to take it easy.
Let's practice changing direct sentences into polite ones. 1. Direct. Where's the doctor? Polite. Excuse me, could you tell me where the doctor is? 2. Direct. I don't understand. Polite. Sorry, could you explain that again? 3. Direct. Give me my report. Polite. Could I have my report, please?
Well done. Small changes in tone make a big difference.
So in this chapter, we covered the hospital environment, navigating, talking to nurses, admission, discharge, and the importance of politeness.
And now, it's time to wrap up episode 14B with a recap and closing message.
Wow, that was a full journey today. We walked through doctor-patient conversations, from general checkups to specialist visits, from test results to sharing emotions.
And we didn't stop there. We also explored the hospital environment: reception, wards, nurses, admission, discharge, and the little but powerful role of politeness.
This episode, episode 14B, is part of our medical vocabulary series. And remember, it's actually the second part. If you missed episode 14A, go check it out. That's where we built the foundation: medical word parts, body systems, and symptoms. Together, 14A and 14B give you both the words and the conversations.
And don't forget, this whole series lives in 2 playlists: the Real Life Conversation playlist and the Medical Vocabulary and Conversation playlist. So if you're following either one, you'll always find these episodes right where you need them.
But here's something important. Don't just listen once and move on. Revisit these conversations. Play the dialogues again. Try repeating out loud. Pretend you're the patient, then switch roles and pretend you're the doctor. That's how you'll build real confidence.
Yes, fluency doesn't come from memorizing a list of words. It comes from using them, practicing, hearing them in context, and slowly making them part of your natural English.
So maybe the first time you listen, just relax and enjoy. The second time, pause after us and repeat the phrases. And the third time, try the practice sections without looking at your notes.
Think of it like exercising a muscle. Every time you use these conversations, you're strengthening your English.
And one day, you'll be in a hospital or clinic and the doctor will ask, "What brings you in today?" And you'll answer smoothly, without even thinking. That's when you'll realize, I've got this.
Exactly. That's the goal of FluentEars: making English feel like part of your life, not a subject in a textbook.
Now, before we say goodbye, here's a little preview. In episode 14C, we'll move deeper into the medical world. We'll cover treatments, medications, and emergency situations. That's where the real-life urgency kicks in. How to ask for help fast, how to understand prescriptions, and what to say in an emergency.
So stay tuned for that. If today was about confidence in everyday hospital situations, episode 14C will prepare you for the critical ones.
All right, FluentEars family, thank you for spending this time with us. We're proud of you for investing in your English and in yourself.
Remember, learning English is like staying healthy. It's a journey, not a one-time event. Step by step, practice by practice, you'll grow stronger.
So keep practicing, keep smiling, and keep believing in yourself. We'll see you soon in the next episode. Take care and happy learning.